Well, good morning, good afternoon, and good evening, wherever you are, and welcome to the March 2025 edition of UW-Madison Global Health Institute's Global Health Tuesday webinar series. Thank you all for joining us. My name is Katie Newcomb, and I am the Communications Director of the Global Health Institute. And today I have the wonderful pleasure of presenting today's webinar, which addresses connecting health through impactful storytelling. At GHI, we are conveners who believe in addressing global health challenges begins with investing in community-level conversations. We foster collaborative, One Health-focused discussions which connect the pulse of human, animal, and plant health to transform global health perspectives through multidisciplinary and multi-sectoral approaches. Our work is rooted in the Wisconsin idea, a practice which takes knowledge and research out of the classroom and into real-world settings. Our Global Health webinar series features researchers and practitioners from the University of Wisconsin-Madison and around the world to highlight and examine the complexity of global health challenges and the many kinds of expertise needed to address them. As a communications practitioner for nearly 30 years, I've had the privilege of honing my storytelling craft in academia, government, nonprofits, agencies, industry, and entertainment. Along the way, I've been given access to many sensitivities and respect the delicate balance of the sender-receiver relationship in order to convey information, especially with the news and public press. That's why it's my honor to introduce our 4 talented guests who will guide the discussion and share their experiences working in various communications capacities to highlight the importance of relationship and trust building, to share fact-based health stories, and also the importance of preparing health leaders to communicate with the public. We thank all of you for your time, leadership, and work, and I truly am looking forward to this discussion. But before we jump in, 2 quick housekeeping items. 1, we are recording today's session, and the archive video will be available at our website at ghi.wisc.edu. And 2, we're monitoring the chat. So please go ahead and share your questions and comments for the panelists throughout the webinar. And we have a great panel, so let's get started. Today, we first welcome our moderator, Sara McKinnon. Sara is a professor of Rhetoric, Politics, and Culture in the Department of Communication Arts in the College of Letters and Sciences at the University of Wisconsin-Madison. She is also the director of the Latin American, Caribbean, and Iberian Studies program, as well as co-chair of the Human Rights program. Her research focuses on the areas of migration, legal studies, and gender and sexuality studies. She is the author of the book Gendered Asylum: Race and Violence in U.S. Law and Politics, which charts the incorporation of gender provisions in U.S. refugee and asylum law within the context of broader national and global politics. She is also the co-editor of the book Text and Field Innovations in Rhetorical Method, which considers a range of approaches for using ethnographic and field-based research methods in rhetorical research. And also, she's co-editor of the book Foreign Policy Rhetorics in the Global Era. I'm proud to say that Sara is also a member of our GHI Advisory Committee. So welcome and thank you, Sara. We also welcome Riley Ray Griffin. Riley is a technology reporter for Bloomberg News. Now based in San Francisco, she previously spent more than 6 years covering U.S. health policy, politics, and the pharmaceutical industry from both New York and Washington. And last year, she took to the campaign trail to cover the 2024 U.S. presidential election. Riley's coverage of the COVID-19 pandemic and U.S. health agencies has been recognized with Loeb, National Press Club, and Front Page Awards. She remains fixated on the ways innovation outpaces regulation, creating key tech advances and also national security risks. Welcome and thank you for joining us, Riley. Next, we welcome Apoorva Mandavilli. Apoorva is a reporter for the New York Times, focusing on science and global health. She shared in the paper's 2021 Pulitzer Prize for Public Service for coverage of the pandemic, and was also a member of the team that was a finalist for the 2021 Pulitzer Prize for National Reporting. She is the 2019 winner of the Victor Crone Prize for Excellence in Medical Science Reporting and has won numerous awards for her writing. She is also a Badger alum. Welcome and thank you for joining us, Apoorva. And lastly, we welcome Jamie Hansen. Jamie joined the Stanford Center for Innovation in Global Health in 2021. As communications manager, she advances and amplifies the work of the center and its fellows through compelling storytelling and strategic multimedia communications. She also builds communications and storytelling capacity among a new generation of science communicators through programs such as the Global Health Media Fellowship and Science Writing Advancing Planetary Health. Before coming to Stanford, Jamie worked as a director in communications at the Sonoma County Office of Education between 2015 and 2021. In this position, she developed the organization's strategic and crisis communications capacity, supporting response to devastating wildfires and the COVID-19 pandemic, while also enhancing its capacity to listen to student voices and tell their stories. Prior to working in communications, Jamie covered education and the environment as a print and multimedia journalist. She holds a master's degree from Stanford. Thank you so much for joining us, Jamie. And now I'm going to hand it over to Sara, who is going to begin this fantastic discussion.
Thanks so much, Katie, and thank you all for being here today. I don't want to spend a lot of our time giving initial thoughts, but I wanted to do a little bit of setup. As a communication professor who works on contemporary complicated issues like immigration and refugee resettlement, I think it's so important that we're thinking about how to develop nuanced, complex stories that still remain clear and simple so as not to lose the audience. So I'm really excited to hear from our panelists today about how they go about doing that, or how they prepare experts in the field, practitioners in the field, for doing media work so that they can tell their stories. So within the field of refugee and migration policy, one thing that is so clear to me is that we are in dire need of thoughtful and nuanced stories that really humanize what immigrants and refugees are experiencing, or why individuals must flee their homes, or what it's like to attempt to seek safe residence and integration in new communities. There's so many negative, stereotypical portrayals of immigrants and refugees, and so I'm really excited to learn some tips and apply it to the fields that I work in. My sense is that the realm of health is much like the realm of migration. We need new, different, thoughtful, and complex stories about health. As I see the rise of anti-vaccination beliefs in the United States, or cuts to funding for the support of HIV drug therapy and malaria treatment in developing nations, I can see the need for storytelling that really targets different audiences and uses new narratives to cut through the noise. And so for this, I'm really excited to learn from our panelists today. I have a lot of questions, and I'm sure you will as well. And so my hope is that we can all leave with some great ideas about how to tell more impactful stories to different audiences about the issues that matter most to us. So with that, I am going to pass it over to Riley to get us started, and then we'll move through a series of opening statements, and then we'll open with a Q&A discussion at the end. Riley, the floor is yours.
Fantastic. I hope you all can see and hear me okay. If we have technical difficulties along the way, just let me know and we can come back. But it's such an honor to be here. What an impressive group of people. And thank you all for attending. And we were all just chatting amongst ourselves before this started. It feels really fitting to be having this conversation today. Today, March 11th, marks the 5-year anniversary from which the WHO declared a global pandemic. And I think as communicators, that is a really unifying subject and one that we'll be talking a lot about. And there's no doubt it's touched everybody who is watching. So excited to get into it. I'm going to share my screen and tell you a little bit about my work. But I want to leave most of the time to the Q&A as well. But just to get us started here, I am now in San Francisco. I'm a tech reporter now after more than 6 years covering healthcare in different capacities. And I will tell you a little bit about that journey for me and how it relates to this very subject in a moment. But before we get into that, I thought it might be helpful to tell you a little bit about journalism. I know not everybody here is a journalist, and there's some mystique around the world of journalism, but I think it really builds trust to talk about our process. So let me see if this clicks. I want to talk about beat reporting for a second. I've considered myself a beat reporter. When I started at Bloomberg, I was a pharmaceutical industry beat reporter, which meant that I was covering the biggest pharma companies, Pfizer, Johnson & Johnson, Eli Lilly. And I started this job in 2018, which meant I got to know these companies' pipelines, their C-suites, what made the businesses run. At Bloomberg, we are a business forward news publication. But it was also a new era for me thinking about healthcare. I don't have a background in healthcare. I imagine many of you here do. But I had to ride that steep learning curve, and it was quite a process and education. But to explain what a beat reporter is, it's really just a subject matter expert. It's the lens through which you conduct your reporting, and that can be institutional, it can be geographical, it can be thematic. You can be a beat reporter on the Department of Health and Human Services or pharma, as I was. You can cover a city or a state, a New York courts beat reporter, for example, or covering the state of California generally. You can also be thematic. I have colleagues who think of themselves as economic statecraft reporters. How is the economy part of this kind of a geopolitical turf war, or thinking about climate change? So something that cuts across different themes. And in my career at Bloomberg, I've covered pharma out of New York. After 4+ years, I moved to Washington, D.C. to take more of a policy approach to healthcare and look at the Department of Health and Human Services, and a particular focus on the CDC because it was in the wake of the pandemic. And then I, as mentioned, jump on the campaign trail, and now I am out in California covering big tech. But beat reporters, people have covered the CDC or HHS or tech or presidential campaigns before, and we all want to make our mark. So you want to differentiate yourself and find your focus. And I think being a journalist, if anybody here is debating, is just such an amazing job because you lead with your curiosity. And a beat often chooses you. You don't necessarily get to strike your own path and say, hey, I want to cover pharma, given the way the industry works. But once you dive in, again, it's just the lens at which to look at the world. And that means you've got some bread and butter responsibilities, like if you're covering companies, looking at earnings releases and financial reports, press releases, legal filings. If you are thinking about public health, or maybe you're looking at clinical trial data, academic journals. You're thinking about leadership changes at agencies or companies. You're thinking about what that means for the end user, whether that's someone who's taking a drug, whether that's a voter, whether that's an investor. So you want to think end to end, both about the entity you're covering and all that those impact. And again, pharma might seem like a niche beat, but it's not, because within that, you could make your focus the drug pricing debate or inequities in clinical trials. I've put some examples up here. But again, homing your subject matter expertise by going narrow and going deep. And as journalists, we balance breaking news, near-term enterprise, long-form features. Sometimes we're responsive. So I've given some examples here. So something happens and we have to respond to the news. Back when I was covering Pfizer as a beat reporter, that meant, okay, what what does their M&A look like? Or what's their vaccine sales forecast? Or what challenges are they seeing with certain drugs? It also means you try to scoop, which means you break the news first, or you tell it a nugget of information that people may not have known before. So these are some examples of not responding to the news, but learning something and breaking it before the company does or your competitors do. And that's another part of the job. And then there's the kind of bigger swings. And I like to call this, someone along the way, I don't know who coined the term, but a string of pearls approach, which means by developing your subject matter expertise, you have little nuggets of information or stories along the way, pearls, if you will. And then when you want to have a bird's eye view story that looks at an issue, you string those pearls together. And I believe I wrote this back in 2022. Pfizer had ridden the highs of COVID. It had pretty much doubled its revenue in a couple of years. And there was this looming question of, can it continue to ride this high? And what happens when vaccine sales start to dry up? And it hadn't quite happened yet, but I point to this story because it's one that's continued to loom over Pfizer years later. I mean, it's still relevant today. And sometimes you can only tell this story when you've looked at the problem from so many different angles that all the pearls come together and you see the necklace form. After covering pharma through COVID, which was a breakneck job, and Apoorva here, I'm sure, can tell the same story. Us reporters on healthcare became COVID reporters, and it was an around-the-clock job. In 2022, I felt that the world was starting to return to a different place, or specifically in the pharmaceutical industry. So there was a lot of new attention to weight loss drugs, and I couldn't shake COVID. I was having a hard time moving on from that story. So I actually pitched moving to DC and continuing to write about healthcare through the lens of national security. And for some reason, my bosses took me up on it. And so they sent me to DC, and we ended up reframing that as a national healthcare reporter. So looking at government agencies, of course, and thinking about health security, but also thinking more broadly about what are the biggest health stories of the day and how can we swing big at them. And so that was really wide-ranging, from thinking about health policies around marijuana to thinking about the Pentagon's role in assessing drug quality, to thinking about the fear among security officials about biological weapons enabled by AI, to looking at some of the reproductive health stories of that time. For example, the Alabama ruling that led the University of Alabama to pause IVF treatment after the state made a Supreme Court decision that suggested that embryos basically had the same status as humans. And there's one story I did want to point out here because I think it speaks to this broader conversation. U.S. troops reinforce hospitals in COVID's battle of attrition. This was before I made a change, and we were still, it was, I believe, around Omicron. And a lot of hospitals in the country had their staff was out sick. It wasn't a challenge of the sickest patients, but it was a challenge of no healthcare workforce. And so I went and embedded with the troops. Biden had deployed the troops to hospitals to make up for those doctors and nurses who were out sick. This was at University Hospital in Newark, a big public hospital. And something I found that I think a lot of people reporting on COVID at that time was we were in this moment in which vaccines were widely available. And yet vaccine skepticism, anti-vax sentiment, and just mis and disinformation online was really creating what some called an infodemic, where it's hard to see the vaccine get to those in need. And in this time, in this experience at the hospital, I saw one person in particular come in who was about to be intubated, and they were asking for the vaccine at that moment. And it was a really heavy moment for me as a healthcare communicator, because I had felt like, goodness, I've failed this person. We've all failed this person, that they're reaching this stage of their own healthcare process and wanting a vaccine at a time in which it won't be beneficial to them or useful to them in the ways that they want, to prevent intubation. There was a breakdown in information. And I think it's something we're all grappling with, is this question of how do we reach people with accurate information at a time in which also the distribution of information has changed with social media, and there are other forces that are spreading mis and disinformation.
Good. How are you? Good.
I'm going to gloss over this, but stories about the opioid epidemic were another part of my role as a national healthcare reporter. And maybe we can talk about that too, because it's a crisis that remains prevalent. And then before I pivot back to you all, just wanted to mention this story. So after 6 years covering healthcare, this felt like the string of pearls. The 5-year anniversary for COVID was coming up, and again, I couldn't shake the pandemic in my mind, and it felt like everybody had moved on, particularly industry, from pandemic threats. And yet Abbott Laboratories, which is a big diagnostics company and medical technology company, was doing this interesting research all across the world, including in the Amazon, including with folks from the University of Wisconsin, to look for what the next threat would be, and threats exacerbated by climate change, thinking about this through the lens of migration, which Sara mentioned. I mean, all these things, all these themes came together for me with this story about a company that was still investing to find the next pandemic threat, even when so much of the world had moved on and industry had moved on. And, second plug for journalism being an amazing thing. And I'm so lucky to be at a newsroom that has the resources to deploy to cool stories like this. But I traveled to the Amazon last year to watch this work in action, and just an amazing feat that the world of public health, still paying such close attention. And it's folks like Juan Pablo Hernandez and Jorge Osorio, who are both affiliated with the university, who are keeping this work alive. And so joining, the boots on the ground and seeing it through their eyes, it has just been so powerful to me. And I'm excited to talk about some of these stories and my journey to tech reporting. I didn't even finish that story. The end of that story is vaccine mis and disinformation has really motivated me to think about the information ecosystem. And so I took a leap to move to San Francisco to think more deeply about that. And so now I'm a tech reporter. I'm not covering public health in that same way, but I hope that it will enrich my understanding of health communications moving forward. So excited to hear from the rest of the panelists. That's a little bit about me, and thanks for listening. And if you ever want to get in touch, my email is there below. Happy to talk about healthcare, the election, tech. Again, thanks for your time.
Awesome. Thank you so much, Riley. Next, we'll move to Apoorva.
Great. Thank you so much. Very excited to talk to you all and listen to your questions. I always really enjoy the Q&A portions of these things. I'm going to share some slides as well. And I'm not the most tech savvy person, so just let's hope it all works out. Okay. So as others said, since today's the anniversary, to me, it seems particularly appropriate that we're talking about this. And I wanted to start with this. This was the very first story I wrote about COVID. And I joined the New York Times actually to cover COVID. So when I wrote the story, I was still a freelancer. I was the editor-in-chief of a a autism news site. But I had been freelancing for the Times for a couple of years, writing about infectious diseases, which is sort of my first love, and had been very excited to write more and more because as an editor-in-chief of this magazine where I didn't really get to do much news reporting. Definitely got to edit a lot of news, but I realized the reporter part of my brain was just itching to go. And so I started to do more news for the Times. And as you might hear from other Times reporters, the Times is a beast. It sucks you in. So the more I did, the more they wanted. And I ended up joining staff there to cover the pandemic. But this one was the very first story I did. And I did the story in part because I had covered SARS, the SARS Classic, the first one. And I remembered from it that kids didn't seem to get that sick. And early in January, there was a paper actually in the New England Journal of Medicine from Wuhan, where it had a list of all the patients that they had seen and all the symptoms that those people had, and there was nobody under 15 on that. So I noticed that, and the same pattern had been true in MERS. But of course, you don't want to go out there and say, hey, none of the kids are getting sick. Kids are going to be just fine. But I also did want to put the thought out there. And so I wanted to show the slide to show what a lot of things reporters can do to get information out to people, but without overselling the point, and to have all the appropriate caveats. And in some ways, we can do that before public health authorities can. So at this stage, you were not going to find any public health authority. This was published February 5th, I think, something like that, or end of January, around there. And CDC wasn't going to come out and say, your kids are going to be just fine. That's just would be irresponsible. But as a journalist, I could go out there and say, look, this is all the information we have so far. And you'll see all the ways in which we caveated this, right? Why the new coronavirus mostly spares children. So far, very few young children seem to be falling ill. And then why we think this, because the pattern was also seen in outbreaks of SARS and MERS. And then the story itself talks about how it's not that unusual for kids to react more mildly to a brand new pathogen because their bodies are used to it. That's what their bodies are primed to do in a way. Whereas for an adult to encounter a brand new pathogen is a big deal. And so he talked about some of the biology. So that it basically explained all of this rationale. And to me, this story really set the tone for my coverage throughout the pandemic. So even this was a couple months before they kind of yanked me in as staff. But even before I did that, it was, at a massive newsroom like the Times, COVID became everybody's beat. Eventually in the pandemic, it was just my beat. But as Riley was pointing out, it's like, you have beat reporters, but at a time when no one was traveling, there's no need for the travel beat. And so the travel reporters were also COVID reporters. We had a sports reporter listening to the daily WHO briefings. Every single person in every single bureau was a COVID reporter. And so I didn't want to spend a lot of time chasing after news that anybody can cover, information that is easily accessible. I didn't want to sit at the WHO briefing meetings and regurgitate that. So I thought about what can I bring to this that maybe nobody else can. And part of that is virology. So, they mentioned in my intro, I was a Badger. I went to grad school at the University of Wisconsin. And I was a graduate student in the biochemistry department. But before I settled on biochemistry as my thing, I also did a rotation in virology. So I have enough background in virology and in biochemistry and cell biology to understand viruses and how they might be interacting with the body. And so I really leaned into that in a big way during the pandemic, covering sort of the science of what was happening. And I don't think I actually ended up keeping that slide, which is too bad, but I had a bunch of slides showing the kinds of headlines that I was able to cover, the kinds of articles that I wrote that you would never in a million years before the pandemic have thought would run in the New York Times and be read by millions of people. It was about things like, one example I will give you is that I wrote about the cycle threshold value of the PCR test, which is basically an indication of how much virus there is when you take that test. I explained what it was, why a high threshold value means, a high CT value means there's not that much virus, and it might indicate that your infection's already over, which is why rapid tests might be more useful. Now we all kind of know that concept that rapid tests are great for active infection, but at the time that was sort of the first inklings of that conversation. And that story was read by millions of people about a PCR test, cycle threshold value. So to me, that was a lesson in people wanted to know everything. And I was there to give them the nerdiest of the nerdy science. I made that my job. The other way in which I really tried to make my niche is I love accountability reporting. I feel that that is one of the most important jobs of a journalist is to hold power to account, to hold, people, agencies, scientists, public health authorities, public health messaging, all of that to account. And, at the Times, we talk about doing that without fear or favor, meaning it doesn't matter who it is. You cover it the way that it needs to be covered without being afraid, without bias. You just go in and you tell the story. So sometimes that meant really just exposing a lie. You might remember this particular time, this was in August 2020, the CDC came out with this guidance saying people who are asymptomatic don't need to test, which was just weird. And everybody who knew enough about COVID by that point, which was basically all of us, knew there was something not quite right about this. The way that the guidance was written was also a bit suspect. In fact, in this article, I remember one of the experts I quoted said, when you read a CDC guidance, it's like Shakespeare, and this reads like Pulp Fiction. It was like they didn't use all the nice CDC-ish language. So there was a tell here that this wasn't actually written by CDC scientists. And what I was able to find out in reporting this piece, I was, able to get a hold of some emails that basically showed that the guidance had been written by Admiral Brett Giroir, who was then the Deputy Secretary of the Department of Health and Human Services, and that had just been presented to CDC scientists as a fait accompli. They would be like, this is it. And they tried to protest and say, but this isn't right because da-da-da. And they were told, no, you do not have the ability to edit this document. So sometimes it's as simple as that. Like, this is not from the CDC. This is made up by somebody else. Sometimes it's more subtle. If I had to pick one story that I'm sort of most proud of in my career, especially the COVID part of it, this was probably it. You might remember the resistance to agencies talking about the coronavirus being airborne indoors. There were a lot of things, considerations that went into that, including the fear that there would be a run on N95 masks for healthcare workers. And so the agencies, CDC and the WHO, and a lot of public health experts were just not giving it to us straight and saying, this virus is airborne indoors. You need to protect yourself by wearing a mask, etc. And so I had a bunch of sources in the global health world, and if you are all familiar with global health, everything connects to the WHO. And so talking to people, getting people to tell you things is really difficult because if they piss the WHO off, they may never work again in the field. So this reporting took months, but it was really worth it because basically I kept pulling at the string and I got a hold of internal documents and phone calls and emails and things like that. And what became really clear was that they actually had heard very compelling scientific testimony about the virus being airborne indoors. They had had all these particle transport experts like, Lindsay Marr, who, was an expert in how viruses move through the air. People like that had come and testified in front of the WHO, had tried to explain to them what this virus was actually doing in the air. But there were just a couple of people, and in particular, one scientist who was the head of the Infection and Prevention Control Committee at the time, who was obsessed with hand hygiene. That was his baby. And he was convinced that if you told people to both wash their hands and wear a mask, they would not be able to do both. And so the WHO decided to go with hand washing as their primary recommendation. And it was fascinating to see that one person was changing the course of this conversation, and this committee just sort of went along with that. And as you know, the WHO gives recommendations to hundreds of countries. Well, there are only a couple hundred, but dozens and dozens of countries that don't have their own CDC to give them recommendations. They all rely on the WHO. So this was literally a matter of life and death. This story came out on July 4th. I was a little worried no one would read it because it was July 4th. It was a Saturday, but it made a big splash. And then on Monday, July 6th, Reuters asked the WHO, hey, what about this New York Times article? What are you going to do about it? And they said, oh, no, we know about this. We've been thinking about this, and we're reviewing the evidence. They said that on Tuesday in an official statement. And then on Thursday, they acknowledged, yes, the virus is airborne. And the reason I said this is the story I'm most proud of is because that literally became then the recommendation, and it allowed countries to move forward with the kinds of things they needed to do to protect their citizens. But it was, to me, the reason I like to show this is because it's, to me, a proof of how powerful journalism can be. That when you hold power to account, that when you really look at whether the information coming out of these authorities is valid, you have the power to really change things. And, the WHO and the CDC before the pandemic were not necessarily organizations that I would have been taking such hard hits at. Of course, as a journalist, you always are critical about things they say, but maybe not quite to this extent. But definitely the pandemic really changed my relationship with these agencies in that way, that I never look at them the same way again. And have less trust and less sort of instant credibility, instant credulity in about what they say. And this story came out much, much later than that. So that was, July 2020, in the thick of things. This story came out 3 years later, but it showed the CDC's own journey with that same thing. And here, to me, this was more of storytelling. This wasn't just, reporting. I had a whistleblower, and I was able to recreate these events that happened behind the scenes in the CDC through this whistleblower who was an epidemic intelligence service fellow. But really, I told the whole story through their experience, that of those fellows, their confusion, because they had joined the CDC in July 2019, starry-eyed, full of excitement about being at the CDC, and then they saw how the agency was politicized, and that they all knew that the virus was definitely spreading indoors through the air, but the agency was not really being forthcoming with that information. They all became really demoralized, and my whistleblower left partly for that reason at the end of the fellowship. So this was a retelling of what happened, and there's some, there's sort of dramatic scenes in there in a way, but it came to the same thing, which is the agencies knew and they just didn't tell the public. And throughout the pandemic, there were things like this where I felt like it was my job to sort of set the record straight. Here's, Dr. Walensky, when she went on MSNBC and said vaccinated people don't carry the virus, they don't get sick. And I was like, wait, I think that's not right. Because even though we didn't know any of that for sure, I knew enough about respiratory viruses to know that that did not sound right. And so, of course, I went and talked to experts, and then she walked the comments back after the story came out. She was basically forced to. This was about breakthrough infections, same thing. They were not telling us that, related to what she said, that vaccinated people don't become sick. The CDC did not acknowledge that this was happening for a really long time. So I went to state dashboards because the CDC was not even carrying that data and had tried to piece it together. And if you've ever looked at state dashboards, oh my God, they all do different things. They all slice and dice data in a million different ways. So in the end, even though I looked at all of the states, I was only able to compare apples to apples data from like 7 states, but that was enough to be able to say, no, this is definitely happening. There are vaccinated people in the hospital who are ill enough, not in huge numbers, but it still needed to be acknowledged. And then the CDC took a few weeks after that, really, to acknowledge it. And that continued. This was February 2022. CDC was still not publishing data on who was in the hospital by age, race, sex, vaccination status. They had all that information, but they were not being forthcoming with any of that. And some of that is still true, by the way. And their reasoning for that was that because it might be misinterpreted as the vaccines being ineffective. And after, I pushed them on this, they did come up with some of the information, but like I mentioned, some of it is still secret. And I think what that does is it really breeds mistrust. Riley mentioned mistrust and misinformation about vaccines. And I think what happens when people are not talking about certain things is that it leaves the room open for wrong information to get in there. And also it leaves people with a sense when they find out, truth will always out. So if the data is being hidden and then it somehow comes out a different way, then people are left feeling, well, what else are you hiding from me? What else are you not telling me? And that can really create a sense of paranoia, and we're being lied to. There's a conspiracy, and boom, there you go. Open the door to misinformation. So this is a story I did last year about, people who really believe that they have been harmed by the vaccines. I think this is one of those unfortunate things where, of course, the vaccines have side effects. What doesn't? Everything does. And yet we were just not talking about it. And these people that I talked to, maybe their side effects are related to vaccines, maybe they're not. But the point is that no one was taking them seriously, and they were being told they were anti-vaxxers simply for raising the question. So for a story like this to have impact, I did not want those people to be dismissed as anti-vaxxers off the bat. So even though I had talked to dozens of people I really focused only on people who had advanced science degrees. That was my way of saying, look, these are actually scientists, doctors, nurses, people who really believe in vaccines, who have always supported them. And then they had these side effects, and their own families and friends were telling them that they were anti-vaxxers simply for raising the issue. And how are we letting this down? So the story went into like all the vaccine and the side effect systems that we have, to look at that issue, and talked about how difficult it is to do that in the United States because we don't have a centralized healthcare database. People might go one place for one thing, another, CVS here, Walgreens there, a clinic there, a hospital there, and all the records are in different places. So it's not easy to figure out, to put those patterns together and say X number of, percent of people who got this vaccine had this side effect and had these, medical issues 8 months later, or whatever the finding might be. And so it's been really difficult, but other countries have done some of it, and we're not even acknowledging some of those side effects. So this story did a lot of that. And to me, again, this is very counter-establishment. If you think of me as a public health reporter who supports public health, of course, and throughout the pandemic, there were public health experts who constantly told me I was undermining the vaccines by raising any questions, talking about whether everybody needed boosters, talking about side effects, talking about whether all vaccines are the same. And I'm here to tell you, I'm not a public health expert. It's not my job to make sure people get vaccinated. My job is to be a reporter and give people all the information so that they can decide what they would like to do. Again, just to say, don't drink the Kool-Aid. I'm a firm believer in not drinking the Kool-Aid, no matter who's providing the Kool-Aid, even if it's the most trusted authority in the world. This was a case where I happened to be in Uganda for something else, and they were talking about this anthrax outbreak, and as if it was a done deal. But then when I actually went to the town and got the records from the tiny little public health department, they had only done like 2 tests. So it was all based on a lot of conjecture. And I think it's super important. Of course, obviously, people can't always take themselves to the tiny town in Uganda, but just to make the point that it is, I think, absolutely essential that we are always asking, what are we really basing that information on? What do we actually know about the situation? And I wanted to end here because Dave Weldon is the nominee for CDC director. His confirmation hearing is he's in front of the Senate Health Committee on Thursday. And I saw him being described as anti-vax all over the place. People like Scott Gottlieb, who used to be the head of the FDA, was going on TV saying Dave Weldon is an anti-vaxxer, and I think he would wear that label proudly. Well, I talked to Dave Weldon, and he said, no, I'm a doctor in Florida. I have patients. I give them vaccines. He did oppose the MMR vaccine, and that is also in the story. But he's not, it's not black and white. He's not a villain. Or at least we don't know that he is yet. But he essentially said, I'm not anti-vaccine. And I think it's really important to keep an open mind and to come to every one of these situations without pre-existing bias, without already having made up your mind that this person is good and this person is bad and this is what they do, that everything is complex and it deserves active, new, fresh, unbiased scrutiny. I'll end there.
Thank you so much. And then we will move to Jamie now.
Okay, hi everyone, good morning. I just want to say what a pleasure and honor it is to be on a panel with these incredible journalists whose work I admire so much, and that is so valuable to the world of public health and global health. So thanks everyone for being here today. I'm going to go pretty quickly because I know we want to have some time for questions at the end. But I wanted to just tell you a little bit about my work at the Stanford Center for Innovation in Global Health. Everyone can see the slides okay? Perfect. So I have a little bit of a different perspective to share because while I was a journalist in a past life, now my work is as the communications manager here at the center. This is a part of our wonderful team. It's a very mission-driven team of people really trying to make the world a more just and healthy place. I love the role that I get to play there, both as a storyteller, telling the stories about the research and the initiatives of our center to hopefully amplify the impact and the findings in the broader global health community in the world, but also helping to support and train another generation of global health and medical storytellers. And so that's what I'm going to talk about today. And I'll just go through this really quickly, but there's a couple programs that we have at our center that are really designed to do just that. And this first one is the Global Health Media Fellowship. And I think, as both of our previous speakers discussed, there's a lot of mistrust and misinformation out there in the world today, especially as it pertains to health. And while a lot changed during the pandemic, doctors and other medical professionals are still some of the most trusted professions that are out there. And so they have this really powerful role they can play in building health literacy and public trust in health. So what this fellowship seeks to do is train one medical student per year. It's a year-long program. We recruit from medical schools around the country. And the goal is to really give them an immersive year in the fundamentals of good journalism and health communication, and then more specifically, global health storytelling. And so they spend a quarter getting really the basics of journalism in the Stanford Journalism Master's program, and then they go to CNN Health and embed with their team there for several months, both contributing to reporting and helping with fact checking and helping the team understand, which research might be problematic, which is good to follow. And then finally, they spend the spring quarter, we fund them to travel somewhere that they've identified an untold global health story that they want to report on, and they get a chance to do that. And so if anyone here is interested in that, the window for applications, opens in December and closes in January. And this is just a quick snapshot of some of our most recent fellows' learnings and insights from this fellowship. On the right, you'll see some news clips of our current amazing fellow Neha, who's been at CNN as this measles outbreak has been taking place, and she's been able to do some really great stories capturing some of the nuance related to that developing story. And I think one thing that she says and that many fellows feel is that the fellowship really gives them a chance to learn how to translate the medical expertise and the scientific jargon that they have accumulated in their training and find a way to communicate that with people in a way that they can make informed decisions about their health. Mira was last year's fellow, and again, she's talking about the really importance of learning how to harness the knowledge and trust that physicians have, and then connect that with a broader public audience. And she plans to use the training. She's going to be a pediatrician, so she's planning to use the training to help advocate for child health globally. And then the last perspective there is from Gina. She was a fellow during the COVID-19 pandemic and describes the infodemic that Apoorva mentioned as well. And just really underscored for her the power and responsibility that doctors, again, have to stop misinformation. And while this fellowship only reaches one fellow per year, I think one thing that's been powerful about it is that many of the fellows then go on to train others, other medical students or other colleagues to do some of the same communication. And I think that's been one really powerful way, because if doctors are to be a tool for fighting misinformation, it's really through those personal conversations with patients or through maybe their own social media followings. In many cases, that can be the most impactful. And then just very quickly, this is another program we launched this year. It's called Science Writing, Advancing Planetary Health, or SWAP. And this one seeks to connect students who are interested in science writing or medical writing with researchers at Stanford who are in this field of human and planetary health, recognizing the interconnection between the health of people and the planet. And these are researchers who have some findings that they think would they want to get it out there into a broader community. They either have a target audience they want to reach, or they want to raise just generally broader awareness of the findings to hopefully have some kind of impact in the world. And so the students are working with them throughout the year and developing communications plans and strategies, and then trying things out to see what works. So we're really excited about this and hoping to continue it in the years ahead. And then lastly, just because the programs I just described are fairly unique to Stanford and the Media Fellowship is just one position, I often hear from people, I think there's just a huge interest out there from medical students as well as other other people interested in public health or realms of science who want to have that skill set to reach a broader community, to translate their research in a way that's understandable by the general public. And so these are some of the opportunities that I've come across that I share with others. And I won't go through them now because I know we're super short on time, but hopefully we can share the slides afterwards, and these might be useful to some of you. And if anyone wants to be in touch or has questions about any of what I described, here's my information. Thank you.
Thank you, Jamie. And now we're going to open it up to questions. And I'm going to jump right into some of the questions that are in the chat because there's some really great questions. I'm going to throw 2 questions out to the panelists, and you can respond to whichever question inspires you most. So the first question is from Ashley, and Ashley is wondering about how you're thinking about going about reporting on health communication topic in a world where the current administration is currently flagging a lot of words as trigger words, so social justice, diversity, equity, bias. How are you thinking about approaching the task of reporting in a world where language is being increasingly constrained? So that's the first question I want to throw out to you. And the next question is from Thomas, and Thomas is wondering about how we reach the general public with stories when fewer and fewer people are reading kind of mainstream established newspapers or mainstream established television viewing, and maybe going to other venues for their information. So I'll throw those 2 questions out. We'll start there, and then we'll go to others after those 2. Thoughts?
I put a link in the chat that is literally a piece that we did looking at all the words that are being censored in federal health communications and on pages. So that's one way to do it, just directly what is happening, but also, continuing to talk to people in the federal agencies, to employees, to constantly try and understand how their lives are changing, what are they being told that they can't do, etc. So anonymous sources within these agencies become incredibly important. And as far as how do you get stories out to people who may not be reading the New York Times, you'd be surprised, because even if people aren't exactly reading the New York Times, the stuff will filter through. Other local papers will cover it, or bloggers will cover it, or it'll get on social media, or people still end up having some access to that story in multiple different ways. So I just keep doing what I'm doing, and I hope that some of it eventually does percolate through.
Wonderful.
To build on Apoorva there, I do think that when there is a lack of information, people try to fill the void with misinformation, but also often if you can provide the answer to that question, it tends to break through. And again, that doesn't necessarily mean that people are reading my story on Bloomberg, but it can be picked up by other outlets, or you'll see that people on TikTok are talking about that finding, right? Like it still is making its way. I think the question that I'm grappling with, and I'm sure every journalist is grappling with, is how do you ensure that that right information is getting out there as opposed to the wrong information? And that's really $1 million question. And it's one that has motivated my shift to this new role. I think there's a lot more we should be doing to understand how people get their information, and how the algorithms work to prioritize certain information. It's a really big challenge, and it's one that's only getting harder. If any of you have followed some of the changes the tech industry has made in the wake of this administration, Meta, which is the broader company that oversees Facebook and Instagram, they're disbanding US fact-checking. That would put labels on certain information to say this is right or wrong, or here's the context. I don't think people realize that program actually wasn't doing political fact checking. That was one of the things that they kept out as a company trying to seem, unbiased. A lot of that work was health misinformation. So that is gone now. And we're going to have to figure out what that means. But if you have answers, if you have suggestions for us in the press as to how to better get our, sound or evidence-based or fact-based information out to people, I'm learning too.
Wonderful. Jamie, thoughts about those questions?
I think to the second question, just one additional thought, and I think, everything is it's a shifting landscape. So when it comes to social media, I think it's a very challenging space right now, especially given the way some platforms are changing the way they regulate information. But I remember there was some interesting research done by someone at Stanford last year looking at social media and how on Twitter, especially misinformation or disinformation spread. And it found that, I'm paraphrasing this quite roughly, but it found that basically there were these kind of nodes of sharing of information. And both in the case of true experts who are sharing good information and those who are spreading misinformation, often it was people who described themselves as scientists or doctors and had, they used the sort of language of expertise. So people were really drawn to that. And they were especially drawn to language that, assumed their audience was interested and curious in the details and the nuance, kind of to Apoorva's point from earlier. So I think that there is value in people who do have good information, who are the experts, going on to these platforms, sharing news that's well reported and discussing it with some level of nuance and transparency. I think that can really help you build trust and reach people where they are.
Thank you. We have another question from Lori, and I'll just throw it out here. How do we handle situations where our own critiques for the purpose of systematic improvement get politicized and exaggerated for political gains? I'm wondering if any of you have thoughts about these, the shift of, the message, the push for social change that then gets taken up in different ways. Thoughts about that?
Sorry, would
And
it
I
be
kind of see
possible
this,
to restate that?
Yeah, I think I see this a lot with in academia, some of the push for social justice, right? So, really kind of pushing to see institutions change in different ways. And now that I think we're seeing in a lot of contexts, pushback or subversion of that message as like anti-DEI or, anti-diversity. And so I don't know, just thoughts about that as you consider this question.
As journalists, I don't know that I can provide guidance on how to navigate that, but I do know that we are very focused on shedding light on those changes, those sea changes, right? It is not our goal for one outcome or the other. We have to remain neutral parties. And I really appreciated the way Apoorva went into depth to show that sometimes a certain message wants to be out there, and it is not our job to deliver that message. And in fact, often the authorities that are presenting themselves as apolitical indeed are, right? Like doctors, public health officials, academic institutions aren't devoid of their biases. And so, we need to stay vigilant and asking the questions of how do you know what you know? Why is this the case? Can you give me examples? So long story short, I don't know that we can guide on how to navigate the sea change, but I do think just shedding light that the sea change is happening is worthy in and of itself.
Got it. That's helpful. And Lori wrote that she was talking more about performance, not social justice. So the social justice is kind of where I took it, but that makes sense. And Jonathan in the chat also says to add to that, we should be careful when rebutting falsehoods to build a truth sandwich. So really thinking about like where, how these pieces of information go together. I think we are at our time, and I need to pass it back to Katie if I'm not mistaken. So I'm going to do that, and we can go from there.
Oh my gosh, our hour went so fast. This was such a fantastic conversation. Thank you to all of you for sharing your time, expertise with us. I want to thank all of you for, sharing your perspectives on building relationships and trust when presenting these health stories and preparing health professionals, for sharing important health stories to the public as well. I just can't believe how fast that went. But thank you to all of you, and thank you to all of you who shared your questions in the chat as well. That said, I want to invite all of you to our next Global Health Tuesday webinar, which will be on Tuesday, May 20th at 9 a.m. Central Standard Time, when we will feature another fantastic panel and discussion focusing on cities, climate change, and health. You really don't want to miss this one. And then I also ask if you want to mark your calendars on April 8th for our Global Health Symposium, focusing on why global health networks matter. This discussion and video will be up on our website on ghi.wisc.edu, where you can learn more about our future events as well. So thank you again to all of you for being with us, and we'll see you next time.